Hey guys, I wanted to send you a video for one of my, it's not going to be the last, but one of my last announcements to you guys as part of this clinical and this course. First, I just wanted to thank you guys. It's been so rewarding to watch you guys grow as clinicians, grow as individuals, really just come into your own over the last 6 weeks of this clinical, trying to translate the classroom learning to the clinical side and dealing with all of the other stuff that you've been with during your clinical. It's been really rewarding for me to be a part of that, and I just want to thank you for all the hard work. I know it was a lot to get to this point, and you got a lot more to go to get to the next point that you'll get to, but I wanted to thank you. I just want to kind of recap a couple of things that we talked about and experienced. And I know those weekly posts can sometimes be tedious, especially with what is the standard of this, and you have to cut and paste it and everybody's got similar answers. But in those weekly posts and in your clinicals, we talked about how is it best delegating a patient to a PTA? What is that process like? We got some differences clinic to clinic on that. Big important topic is Medicare and how we can practice with our patients who have Medicare as their insurance. And and the tough thing about government insurance is if we go against their rules and regulations, it's fraud that we could potentially face jail time for. So that is not as interesting as learning how to fix someone's shoulder or work with a unique disease. But it is maybe the most important thing we have to, because the repercussions of not following those guidelines are so severe. I hope you guys got some experience delegating to techs. A lot of you started as aides, and the importance of delegating and communicating with them and utilizing their strengths to maximize your value was something that was important to experience. And it's hard to think about that in the classroom. You got to be in the clinic to do that kind of stuff. The quality assessments, I think, are so important because, one, we want to be assessing our patients all the time. We talk about that a lot. But there's a lot of you out there that are going to be clinic managers. You're going to be the director of the clinic. Some of you might open up your own practice. Others are going to be the department supervisor at the SNF or the hospital. We're not going to just let the assistant part of your title and your degree be something that can limit you. It is a benefit of yours. And all of these things on not only a quality assessments of our patients and our own performance, but your facility as a whole can be really important for the rest of your career and where you're going to climb that ladder to ultimately where you want to be. And I got to tell you, the values-based behaviors has made me, I think I love those posts the most, to talk about the empathy that you guys feel and why you want to be a member of this profession. It was so warming to read. In those clinical check-in posts, you guys got to talk about the art of physical therapy, right? So we talked so much about science versus art, and you guys got to learn so much about the art of physical therapy. Tanner, with your what to modify with what the patient can tolerate, that was something you just posted on. I think we do that both with tests and treatments. Lewis, reading body language. I mean, that's an art, right? So that's not, first question is, how are you feeling today? Second question is, how much pain do you have, right? So there's so much art to reading that body language, that nonverbal communication. Allie, Brent, and Morgan all talked about patients with strong personalities and how are we going to work with them and maximize our treatment with also making sure they feel empowered as well. And that is always, the difficult patients are hopefully will end up being the fun ones for you, because that means you're really good and ready to tackle the difficult people. I saw a lot of love, the love for profession, the love for individual patients. I think Dallas, you just had a recent post about, not you thought you were going to work with all younger athlete type, and the other people that you liked to work with, or the older people that just wanted to bake cookies or wash their hair. And I think if you're meant to be in this rehab space that we're in, kind of doesn't matter who the patient is. We want to help them get from A to B and B to C and then all the way down to Z. And that Z might be returning to professional sports, and it might be walking to church one more time, like I've been able to share. So you've experienced that, and the reward comes from what we put into it and helping our patients with whatever their function and getting to where they want to be. So yeah, that's the love of this profession. You just, whoever's in front of you, let's figure out what they need. I saw a lot of love in Laura, right? So that is kind of a similar thing when that first patient shared, you helped my shoulder, Laura, right? So great. I mean, what a win, right? So that's the stuff that, you know, we get paid to do the paperwork. Our paychecks that you'll eventually get, we get those to do the paperwork and make sure we're billing appropriately and all that kind of nitty-gritty stuff that you guys worked with. But the internal reward is when that person gives us a hug or the pat on the back or just says, thank you for helping me. You made me feel better. I saw a lot of love, man, with Aiden. I mean, my heart broke for you on how you had to handle that in your first clinical. Having a patient with a cancer diagnosis is not fun. You know, we just want to help them get better, and all of a sudden we're throwing a wicked curveball. So just giving love to that patient was all you could do, and you know, it hurts, but man, you've done a great job. Tips and tricks along the way. I mean, Zach Dion Tanner with Ehlers-Danlos syndrome, Tanner with aquatics, you know, I think Morgan with the PT365 app. That was something that you could also look at, a good tip along the way. So I just wanted to really thank you guys. You guys have been incredible, and you know, I just can't thank you guys enough for everything. And I think you guys have just truly been excellent.